Good morning to all of you. I think I understand, being a one of the last few speakers and holding all of you back. But then, believe me, I will not take more than 10 minutes because I have only 5 slides to show. And some of my work, I think it is made easy by Dr. Praveen Malikji. So I'll just skip those points. I think all the speakers have told Ayurveda dates back to Vedic era. Modern medicine started somewhere in 18th century. We also started with veterinary medicine somewhere in 19th century, and then we have seen how Ayurveda is overshadowed by the advancement in the medicines, and we are happy that now I think last 3-4 decades we have again seen the resurgence of Ayurveda and gaining popularity and institutions like TDU playing a very critical role. So I think in terms of Pashu Ayurveda, let us understand few challenges what we have. We have I think total veterinarians about 80,000 in our country against a livestock population of 540 million or 54 crore animals, and it's really difficult for a one veterinarian to take care of 5,000 livestock units. So I think this is the challenge we have. We have limited access to animal health professional. It's a very large geography, and taking every veterinarian, to treat the animal again is a challenge. We have seen, the lack of awareness and acceptance among farmers for this kind of formulations. Uh, I think Himalayas have already told about the challenge, how the industry level clinical studies is also, is a challenge. And I think one of the most important challenge which dairy sector is facing is the antimicrobial resistance. We have seen the antibiotics in the milk, and its impact is enormous. Many times the milk which we try to make curd because of antibiotics in the milk, it's not bacterias cannot work, and then you don't get curd. So this is a challenge we are facing apart from going these antibiotic residues to human, because we are consuming milk and milk products, and all kinds of challenges which we are facing. And so we thought that I think it is important that let us take some of the knowledge what we have, and we are fortunate we collaborated with TDU. We had a collaboration with Tanovas, and we started working on taking some of these challenges and how we can take a role in maybe making aware about to the farmers that how you can treat your animals with some of the Ayurvedic medicines or some of the veterinary medicines which are already available. So these are, I think, one slide which explains the benefits to all the stakeholders with what we have in the dairy industry. We have farmers. The treatment is very very cost effective, easy to prepare, administer. Ingredients, I think all of these speakers have highlighted how easily those ingredients are available. It is non-invasive. We don't see any milk withdrawal if use these medicines, and there are so many other advantages at the farmer level. And as consumers, we get, I think, reduced antibiotic residues in the milk. We have better product quality, reduce food allergies. I think we have seen lot of allergies coming because of the medicine usage. And unlike those medicines, I think Ayurveda has that advantage and better health, as Dr. Malik explained about the One Health approach. As country, I think it makes easy for the regulatory bodies, because you don't have challenges of antibiotic residues and other things in the milk and milk products. We are really struggling to form the standards for the antibiotic residues or pesticides residues in the milk and milk products. They are so micro level present in the milk, that testing them and then spending lot of money to know the level, I think it itself is a challenge, and it makes easy for the regulatory agencies if we don't have those. Uh, this is what some of the speakers have already told. Recognition of Indian traditional systems, better prospects in the international markets, as Himalaya has told. And with all this, we will be able to tackle the antimicrobial resistance issue. And I think we are also helping by adopting a Pashu Ayurveda. We are also helping the climate, because the if you have the antibiotic free dung, it improves the carbon sequestering. We have seen, you have seen lot of carbon available in the land, but the problem is its absorption. So when you have antibiotic in the dung, actually the carbon which is present on the land doesn't get into the soil. So again, I think a very, very good, advantage which we have is the antibiotic free dung, and we are helping the climate also. So what we are doing is at NDDB, as I told, we had a good collaboration with TDU and Tanuvas. We started working with a small pilot in one of the districts in Gujarat, and what we realized that by in 3 years' time, after we have reached almost 1,000 dairy cooperative societies in the district, the cost of antibiotic reduced from almost 32 rupees to 12 rupees. So that was a immediate benefit which we could measure, which we could see that there is a direct benefit which is available. So then we started supporting other dairy cooperatives. Now we are working with 16 milk unions and some of the producer companies also in 8 states, and we are also providing financial assistance to some of the cooperatives if they are ready to set up a plant for making this Ayurvedic formulations actually. Because for us there are already companies like Himalaya which are available. In the veterinary field, unfortunately, we have very limited formulations readily available in the market. So we have also started supporting the cooperatives for making the formulation. One of the other important work which we are doing is training the veterinary and animal husbandry professionals, because as Dr. Malik explained, we don't have such kind of structured educational program going on as of now, and NDDB is training this personnel on how to make the formulations, what are the benefits, and we are also popularizing the measures on YouTube channel. You can have just visit the NDDB YouTube channel. You have all the formulations available for all common ailments in the animals. Almost 30 ailments we have the readily available videos available on the YouTube, and again on all the regional languages. So the language is also not a challenge, and we have recorded about 7.5 lakh cases so far with various ailments, and our success rate for the clinical recoveries is more than 80%. So this actually very clearly suggests that there is no need, for certain ailments to go for the high-end antibiotics or high-end medicines which are available. So last slide, as I promised, I have only 5 slides, and for a way forward, I think we have a vision at NDDB to become net zero, and this initiative is helping us because this will have the use of Pashu Ayurveda will have a lot of effect on reducing the carbon footprint which the livestock or the dairy industry has. We are working on, with the universities on research and development to take care of nutritional deficiencies or immunity enhancement products, especially after the COVID. Now we have all realized, the immunity enhancement products which are available. We are trying to institutionalize the Pashu Ayurveda based EVM. So we are developing some of the, SOPs, how we can develop the standard operating procedure, standard certification regulations. I think most of the things which Himalaya had, talked about in their presentation. As Dr. Malik told, we are also trying to include the Pashu Ayurveda based EVM in the veterinary curriculum, and we are working with the ministry to see that both the ministries, our own Animal Husbandry and Dairying Ministry and the Ministry of Ayush, to see that as soon as possible this can be included. We are also, as I told, helping the cooperatives to commercialize some of the the formulations which they can make, and NDDB is providing a substantial grant if they are ready to commercialize this process. And extension activity is the core of NDDB. So taking the research which the universities have or some of the developments which we can get from around the globe, we are ready to take those initiatives forward to the farmer, make them aware. And we hope that I think going forward, this Ayurveda, Pashu Ayurveda is gaining lot of momentum, and NDDB will have a very, very crucial role. Thank you so much.